Hi, everybody. It's Sue Ann from the State Unit on Aging. Welcome to the continuing series of webinars for 2016. I don't know which number this is, but we're excited to have Diana White here with me today. I'm excited to have her, and I'm excited for you guys to have her talk with us about the Consumer Satisfaction Survey. This was the 5th year, and so she's going to talk with us about some of the individual results and sort of overarching what some of the things are we've learned over the last 5 years. I want to just give you a little bit of logistics. We are recording this webinar today, and we will be posting it up on the website. We did send you materials yesterday for those of you who were registered. We sent you a link to where you can find these reports from the Consumer Satisfaction Survey on the SUA website under the ADRC section and under 2015 Consumer Satisfaction Report, Survey Reports. As you know, we keep you all muted so that we don't get any feedback or background noise. So if you have any questions, you need to text chat them to us, and I'll keep an eye out for them and try to stop Diana and have her answer questions. If it's a group site, please send us the names of the other folks who were there. So we like to keep track of who comes to these things. Let's see, what else? We're excited to have you, and I think I'm just going to turn it over to Diana.
Okay, thank you so much, Sue Ann, and I am glad to be here. It's hard to believe that 5 years have gone by on this, and I did want to also acknowledge my colleague, Cheryl Elliott, who has worked with me on most of these surveys. A little background, I was involved with ADRC development when one of the grants that you received to develop a training program for options counselors, and it also included an evaluation of the ADRC development as of that time. And so that information, I think, is also available, but it gave me a pretty good sense of the ADRC options counseling and what the goals were. That initial grant, that contract that PSU had involved some open-ended interviews with ADRC options counselor consumers. So we began to get a feel for what consumers were experiencing at that time. Then there were consumer-based standard expectations developed. These were involved after the development of the round 1 survey that we did. And anyway, benchmarks were established throughout following our first closed-ended survey. I mention that because we have tracked that over time from round 2 through round 5. We looked at how the answers were stacking up to how people were doing. And I know that you're not using those benchmarks for anything else right now, but I'll refer to those occasionally because they're useful for comparative purposes. So we did do several reports, and I'll go through those here, but again, you'll find all of these different reports, and they're all pretty short, so they shouldn't be overwhelming when you look at the reports. So we'll start first with our survey participants. We began with a sample, the eligible numbers. We got random samples of everybody using the call center, usually a couple months in the fall, and then randomly selected from that. We also always have used every single options counselor consumer who's in the database for that particular time period. Over time, the call center, we've used a 2-week period. The options counselors, we've used a 6-week period, again, to capture as many of those people as we could. Over time, our response rate has been generally pretty good. And if you look in red is the refusal rate, and it's not bad. In fact, it's declined this last year. There were very few people that we got a hold of that refused. Our problem was finding the numbers, or people not answering the phone, or people screening calls so they only answer. And so I know that's going to be an increasing problem. But generally, if we could reach people, we had a pretty good chance of them agreeing to participate. So over time, our sample has increased. The very first round was quite a bit smaller, and this last year we got 328. Years 2 and through 4, our target was 300, so we were always pretty close to that. There's a little bit of extra funds, so we increased our sample size this year. And here, the breakdown, the far right column is how many people from options counseling, and you'll see that in the very first year, we only were able to talk to 11 people who had received options counseling. So that was a very brand new program at that time.
Yeah, I think we only had like 60 people that had options counseling to start with, so it was a small sample to begin with.
Small sample, and then finding phone numbers and all of that. So this year, we always tried to have a pretty good number of options counselor people in there. This year, we had the most ever. Partly that was our plan. What was really nice is that we not only had the greatest numbers, but they were most representative in the state. In years 3 and 4, they were overrepresented in the metro area because that's where most of the options counselor clients were. So this year they were much more evenly distributed, which we found very exciting. So another sort of caveat here is when I'm talking about consumer here, I'm talking about people who actually receive services. Now, we ask for the consumer database, and there are always some family members, and I know that family members are considered clients and consumers as well. But for our purposes, we distinguish between people who actually receive services and people who call on behalf of a consumer who receives services. So, but, for example, if a family member calls because they need respite care and they get respite care, they're considered a consumer because they are receiving services. So with that, here we are. So generally, most of the people we have talked to have been consumers. Again, that has been our target audience, but it's very helpful and useful to distinguish between the family members that have ranged between 20 and 30% of the sample. This year was pretty average in terms of that. Reasons for contacting the ADRC, that was one of our very first questions is, can you tell me how you came in contact or reason for contacting the ADRC? And these are open-ended comments, and people generally, the major reason people call is they need information or advice, or they have some physical health needs that they need help with. And then there's some people that are a little more specific, so help at home, personal care, Medicaid, transportation, so forth, food stamps, confusion, memory loss, around a quarter of people, less than 20% are the caregiver support, energy bills, dental care, moving into residential, subsidized housing. I should also say we ask an open-ended question, but after that first year, we categorize them, and ever since then, we've asked them first, why did you come in contact with the ADRC? Then we'll say, here's some things other people have said. You know, were any of these reasons for contacting the ADRC? So sometimes, you know, people will say, well, I have a physical health need, but yeah, I need some help with shopping, and, you know, now that you mention it, and yeah, I could use some transportation, but that might not be what they said at first. But at least we have a comparison of responses to the same list. So now, up till now, I was giving an overview of all 5 years. Mostly now I'll talk about round 5, but I will tell you where things have changed over time, where there's some differences. So on average, when we add up those 16 items, people are talking or presenting with about 5 different needs. And families are identifying more than consumers. So families identify 6, consumers identify almost 5. In this year, family members are more likely to identify personal care, confusion or memory loss, caregiver support, respite care, moving into residential care, Medicaid, and medications. In previous years, consumers were more likely to ask about things like Medicaid and paying for medical care. I'll have some thoughts on that a little bit later. Consumers are more likely to be calling about things like food stamps or energy bills. So consumers seem more about the managing, the money side of things and how am I going to finance care. And the family members were more involved with the IAs, the ADLs, and just general living.
And Diana, just to be clear, these calls, the survey actually took place in the fall of last year?
Yes, this is 2015. And the calls were made in October, and these services had been received sometime in September.
Thank you.
Thank you. So we asked people how they heard about the ADRC, and 36% of referrals come from another agency, which is up. So my little color code here is green is more or improvement, and red is a decline or not improvement. And I wouldn't say either of these are good or bad. They're just what they are because they're all great sources of referral. In fact, the very first year we did the survey, the media was huge, and ever since then it's been pretty low. But referrals from another agency went up, which says to me that you're doing a good job with your partners and people are connecting with you that way. Informal sources included things like family, friends, word of mouth. And families are hearing about it from families, which I thought was kind of interesting. And then less is coming from hospitals, clinics, primary care than in the past. Very few of the people we talk to in these surveys use the internet. Okay, so here's that information. So 61% first contacted the ADRC by phone. Some people, particularly few consumers who reported some confusion and memory loss, will say that somebody contacted them. They didn't make the initial contact. 65% the phone was answered by a person, and this declined a little bit from last year where there was a little bit higher rate of being answered in person. And so that 35% who had an answering machine or automated system, 26% of those received a call back the same day. Another 35% received a call the next day, and that is a considerable improvement from last year. 9 people waited 5 days or more, and this is the lowest this has been throughout the survey. So the benchmark that was established was a fairly stringent one after that round 1, and they wanted nobody waiting any more than 5 days. In fact, they wanted everybody to get a call within the first couple days, but realizing that could be difficult. And it was no more than 15% would report that the wait was too long. And as you can see here, only 4% indicated the wait was too long. For all of these utilization data, we asked both their assessment of timeliness, because a time on a calendar might be real different for different situations. It might be way too long for somebody who's in a crisis, but reasonable for somebody else. So we wanted to know that. And then whether they assessed it was prompt and timely. We also asked how helpful the services were. So we had a couple different measures there. 24% went to the ADR building first. That was their first contact with the ADRC, which is more than in the past. And 30% said they had gone at some point. And again, only 2% first accessed the ADRC by the website. And we wonder if the people who do use the website, because we know that the website's getting a lot of use, that maybe people find what they need and then don't really come into your awareness.
So we have a question. Let me see if I can figure out how to read it here. I've had some at ADRC say, okay, so I've had some at ADRC say there is no building. Was ADRC building defined by the survey?
No, it wasn't. We just asked if they'd ever gone to the building. It was interesting that very first year we did this survey, we asked, how people heard about it. And some people would say, well, I've heard about it forever, or I used to work there. And so ADRC was synonymous to them with aging services. And so it may be the same here, too.
Okay. It looks like that's the only question for now.
And the response of the time of the return call, again, more than half said it was prompt and timely, or the wait was reasonable. Much too long, again, was only 4%, whereas in 2014 it was 30%. So yay, that was just an amazing leap forward. When people went to the ADRC, this has always been pretty positive, and it was even more so. We saw a lot more prompt and timely, a little less wait, reasonable, but it's a good trade-off. And much too long also decreased. So very well done. Information assistance, we asked if they had received all, some, or none of the information. A lot more people said they received all of the information they needed, well over half. 74% got written materials, and 93% found them relevant. So you're doing a good job of targeting those materials. And this one I think is really important, that 92% of the people you work with, whether call center options counseling, say staff spends enough time with them to understand their concerns.
Great job, guys.
We also ask about knowledgeable staff, and here we're making some comparisons. One thing about doing satisfaction surveys is that people are generally pretty positive, and they often don't tell you when things don't work well. So you would expect to see positive comments. So I'm always interested in the negative ones. But they're pretty small, and as you'll see over time, the red box gets narrower starting at round 3. So the people from the ADR who are using the ADRC, and the light blue has gotten bigger relative to the dark blue. And so you have over 80% of the people talking about the staff being very knowledgeable, which is the highest rating. So again, this speaks well. And then explaining how to get help you need. This is tricky because, as you know, the system is really hard to navigate. There are a lot of pieces. There are a lot of rules and regulations. And staff is still getting high marks, So 85% in round 5, which is the highest combined, are saying that you did an excellent job in explaining how to get help they needed. So the red is getting smaller, and the light blue is getting bigger, which is what we want to see. So any recommendations we came up with was mostly continue what you're doing, communicating in empathic, respectful ways, continuing efforts to help navigate the website. And I will throw in an aside. I teach a families and aging class, and one of the things I tell my students is I want them to be able to find help for their family members. So they have to do a resource project, and over time, the comments I hear about the ADRC websites are just great. And so the students, particularly this last term, were talking about how great it was, and they also have to look at another state, and they say Oregon is much better than California, for example. I can't remember some of the others, but the website really is great. continuing answer calls in prompt and timely manner, and continue to assist consumers who are eligible for services.
I want to remind you guys, I see a couple of hands raised, and I want to remind you guys that if you have a question, you want to text it in, because we're not going to open the lines up because of feedback and other background noises. So if you have an issue, either text chat it or put it in the question box, and we will watch for it, and we'll answer it, and hopefully be able to answer it.
Okay. So the next section has to do with options counseling. And remember that first round, we only had 11 people, and we had a different length of survey. So we asked more questions for people who had options counseling because we wanted to know more about their services and whether options counseling was working in the way we wanted. So we also asked people if anybody from the ADRC came to their home. And so if anybody says yes, would they get the long survey too? So every year there have been people who said somebody from the ADRC came to their home, so they get a longer survey along with options counselor consumers. We don't know who does those home visits. It could be they've signed up for home health services and somebody comes to their home. So we really don't know who they're talking about. It may or may not be related to the ADRC, but the point for us was that they're getting more significant services. So we asked them about that too. So in round 5, our right column, you can see that 44% of the sample said they received a home visit, and it's always been mostly these home visits go to options counseling consumers, and I know that not all consumers want a home visit or are able to get one, but we see a decline in the number of home visits, and I think that's unfortunate because home visits do so much. People with home visits are more likely to report that they get all the information they needed. They tend to report more needs, and this year family members reported more needs than in the past. They use more services appropriately, and they also rate outcomes more positively. So I would encourage attention being given to getting those home visits as often as possible. People felt the home visits were done in a very timely way, but we had people waiting longer this year. So a third of the people who received home visits said they waited more than a week to get them, but they tended to rate these as reasonable. So only 9% said it was much too long, but that's something to keep an eye on. We asked questions about the person who came to help and overall the benefit of the home visits. Most everybody says they were either very helpful or helpful. I think that is everybody. And very comfortable with the people who come to their home. So again, that's really important. And here's another really important statistic. Over half of the consumers who reported a home visit said that the person who came to their home identified additional needs. And they all agreed, or virtually all people agreed, that yeah, they had those needs. And so we're able to get better services. So another plug for home visits. Family members were present for those home visits only about half of the time, but they were present generally when there was any report of confusion or memory loss, which kind of makes sense. So we ask, and these are all round 5 data, and we ask about some decision support activities, and they were how well did the person who came to your home help you in understanding the service system, available options, exploring choices, considering my opinions, or considering your opinions, supporting your decisions, and how much control did you have in decisions. So the highest marks were on understanding available options, and probably the lowest ones were in control of decisions. which given this population, and we also found that people who there was issues of confusion or memory loss were more likely to say they had no control. Again, it makes sense, but it's one of those difficult kinds of issues.
Well, and I wonder if control and decisions also, I think, would be affected by the fact that sometimes programs have eligibility requirements. Yes. And so they might have wanted that choice, but they couldn't get in, and so they felt like it was out of their control.
Yeah.
So that might be another reason that one is.
That's a really, really good point. And that there's evidence to support that as we go on a little bit. Considering opinions, though, I think, again, the red is pretty little, which is really, I think, good.
Yeah.
Another thing, as part of the standards, professional standards for options counselors, is to help people develop actions plans and then make follow-up phone calls. So we asked, did anybody help you make an action plan? And we didn't call it that. We called it, help you make a plan for what you're going to do next. And more than half said yes, and more than half said that they got a follow-up call from the ADRC. But this is less than that original benchmark, which was considerably higher. About half the people have made a call to the ADRC, and these are not necessarily the same people who received a call from the ADRC or made a call. So at least for half people, I think they're feeling pretty comfortable that they know who you are and have followed through and gotten in touch again. So that's good.
Yeah, and we've also realized, over the past couple of years that everyone isn't always ready to do an action plan. And so, sometimes there isn't an action plan to be made. It's maybe one next step or something.
Yeah. I remember one of the options counselors in the early days saying it wasn't until you dealt with the first crisis that you could actually sit back and begin to do the options counseling.
Yeah.
So that's true. So outcomes, we asked people as a result of the ADRC, and again, these are all people who received options counseling or home visits, whether they were living where they wanted to, whether they had the support they needed, whether they maintained independence or felt safer, pursued the activities that they wanted to pursue. These were do things in the community that I've always done, were able to make good use of their personal resources, or were they able to find help that they wanted. And Sue Ann, this affordable help, as you can see, that wasn't quite as good. And I think it is people fall through the cracks. They make too much money, or they're not in the right services sector, or there's a waiting list, or something that they need they can't get. And so, there was some more disagreement there. Here, the green colors are the disagree and strongly disagree. Use of personal resources very much the same. In fact, that probably had the lowest scores of any of them. So this is where I talk to policymakers in terms of need for additional resources, or looking at eligibility criteria and that kind of thing. The activities is one that's never surprising, but when we're focused on person-centered care, meaningful activities is a big part of quality of life, and often that seems to have to go to the bottom of the barrel because of limited resources. But I think it's important to keep this here just as a reminder that whenever we can, is to help people maintain those ties to the community is really important. So here you see less of the really strongly agreeing with these statements and quite a bit more of people are agree. But overall, they agree more than they disagree with these statements, which again is indicating there's some positive outcomes. Here's another way of looking at them. We also asked people, what would your circumstances have been without the ADRC? And this is an open-ended question, and about 2/3 of people answered it. And a few people say there really hasn't been much change. Very few people said I'm actually worse off because of the ADRC. But most people talk about being a lot worse off, and sometimes that's described. I would be dead was one. I would be homeless. We see a big segment of those all the time. Or I wouldn't know what to do. That's worse emotionally. Anyway, a lot of people worse financially. I wouldn't be able to afford this. I couldn't do this. And it's sort of hard to see this key. But a lot worse is that light blue, starting at about 12 o'clock to 1 o'clock. And then worse financially is the dark blue segment. Worse physically is that lighter green. Worse basic needs wouldn't be met. And then no change is the green wedge, which is probably less than, oh, that's right, worse emotionally is the green one. So that's people talking about, I have peace of mind, I know what to do next. I know that he gets help when he needs it, those kinds of things. And then people said, well, we would be okay if we didn't have it, but it's better. And the no change is that very narrow segment. Thank you. So here's some of those things that people said. We would be struggling more not having the respite, time to ourselves and struggling financially. I would be more depressed and living in a filthy place. I think I would have a harder time not wanting to commit suicide. I would not have health care or to be able to afford to live where I'm living. I would have had to move from here. I would be in a whole lot of hurt. I would have trouble getting meals. And then I was in the dark about services. Once I received information to explore, I was surprised about what services were available. I gained knowledge and referred a friend. My circumstances would not be good. I would not have a place to live, and going to work would be very hard. So, recommendations with respect to options counseling, making home visits a priority, try to decrease the wait time for home visits, but really keep up the good work and decision supports, follow-up calls, and whenever possible, the support to live independently and safely in home are areas I think could be worked on. And the policy issue here is to support the ADRCs in locating or communities develop more affordable services. So we also asked generally about what services people are using. So did the ADRC result in you receiving any services? Now some people, they were pretty new into the system, and so it was in process for some. But 140 of the participants had, the consumers or family members had said that they were using a service, and about 2.5 services. 34% were receiving 1 services, and 1/4 were receiving 4 or more. And people receiving options counseling services were receiving more. This survey, there really were no difference between families and consumers or whether someone had confusion or memory loss. So that's something you might want to think about. You'd think people with confusion or memory loss may have higher needs, but we didn't see differences in service use. So most people talked about help getting benefits, almost half. This was followed by meals, transportation, information about managing their health, housekeeping, personal care, and then information. So satisfaction with surveys, again, we asked the timeliness of receiving services and how helpful they were. The highest scores in terms of helpfulness were meals and benefits and financial assistance. And those scores increased this year. Personal care, transportation have always been pretty high. And this is on a 1 to 4 scale. So these are all the top scores, you know. And managing health was down a little bit, but it's still pretty positive ratings in terms of helpfulness. Timeliness, the information was the best. This is also a 1 to 4, but here the smaller numbers better. Meals, information and meals seem to be delivered pretty quickly. Managing health was down, but again, it's still in the top rated area. So we did one report focusing specifically on people who reported confusion or memory loss. We asked in that first list of need, have you contacted the ADRC because of confusion or memory loss? So that was one thing that we had across all 5 times. But starting, I think, in year 3, and then it was enhanced a little bit in round 4. We asked people if they had noticed an increase in confusion or memory loss over the past 12 months. And so we have the different group here. So 35% of the, well, I'll back off. Family members are much more likely to report confusion or memory loss than our consumers, but the largest numbers, because we talk to so many more consumers and family members, actually come from consumers. So in this sample, there were 80 consumers and 58 families. But again, this was a common theme with families contacting the ADRC. So 35 of those people, or 25 overall, had a diagnosis of Alzheimer's disease. About half of the people with a diagnosis of Alzheimer's disease received options counseling. Overall, that, you know, in total, so we don't know what confusion and memory loss really refers to. It's self-defined. We did ask about this diagnosis of Alzheimer's disease. I think we all know that there's a lot of undiagnosed confusion out there. Consumers may be reporting that because they forget where they put the car keys, that they're experiencing more confusion or memory loss. You know, so we don't know. It probably represents quite a range. But 30% of consumers and family members didn't receive any options counseling or home visits when there was a report of confusion or memory loss. They had a greater need for services. This difference was found mostly by consumer reports. The families this year were calling on behalf of people with some pretty significant needs. If they didn't have confusion or memory loss, they had significant impairment. So when we get into some of these questions, there's less difference between families and consumers because the family members were dealing with everything, is my take on this. The kinds of needs that they had overall had to do with giving information and advice and caregiver respite. There were some differences between round 4 and round 5. This round 5, 2015, consumers with confusion and memory loss talked about physical health, personal care, and moving into residential care. And mostly in the past, we've heard those kinds of needs expressed by family members. Consumers identified both in round 4 and round 5 as need for help at home, shopping, and errands, and subsidized housing. So the support they received, consumers with confusion memory loss were more likely to receive a referral to the ADRC from another agency. They gave lower ratings. Didn't spend enough time with me to understand my concerns, although still the vast majority were positive, and they reported less control in decision making. Those who received an options counseling or home visit was more in round 5 than round 4, and family members did report waiting longer for a home visit than consumers when confusion and memory loss was a factor. There were no difference in the numbers and types of services received, ratings of timeliness or helpfulness, or overall satisfaction. Although the CML group, the last slide, there are always people who are pretty unhappy, and about half of those people had confusion or memory loss. So, and here's that. So pretty consistently over time, about 25% of the sample we asked, do you have concerns that have not been met? And for some reason, for some of these people, it's because they're waiting, that they've applied for eligibility and haven't heard back, or things are in process. But sometimes, they couldn't help me. They already have the answer. And then this comment is kind of typical within this group. No one has come to help. All they did was talk, and then nothing happened.
So this is particularly those confused and memory loss people?
No, this is a whole.
Everybody?
This is a whole sample now.
Okay.
Again, though, half of this sample were people with confusion and memory loss. So disproportionately, we've got that going on with this group, which makes it a tricky group to serve, right? Because if there's significant confusion and memory loss, they're not remembering what you're saying. So customer service is always an issue. Again, you guys, I think, are doing outstandingly well, but it's always something to think about and check in with pretty often. I know that those calls are coming in all of the time, and it's hard to balance being present with people when you know you have calls waiting.
But we can always do better.
Yeah, and
no
so
matter
that's
how well we're doing.
That's what all of this is here. But 93% would recommend the ADRC to a family or friend, so that includes those who still have concerns. And 64% gave it the highest ratings of being very helpful, and only 6% said the ADRC was not helpful at all. So we also did some correlations between the overall satisfaction, and we see that high correlations, again, the importance of staff in this, with satisfaction, a 0.64 positive correlation between satisfaction and all these staff attributes we talked about, understanding the service system, giving positive ratings about outcomes, and ease in contacting the ADRC. So all of those things contribute to people's satisfactions. What's interesting is that there's no correlation between satisfaction with the number of needs people have, the number of contacts with the ADRC, or the number of services they received. We do see positive correlations between needs and services, so what you would want to see, it would be nice if that correlation was higher, but it's moving in the right direction. Okay, so overall, continue the good work, continue to monitor response times, making those home visits a priority, and working on those action plans. These are all those outcome things, really working on all the person-centered safety issues. And services, continue to eliminate the gap between services received and needs for services. Increase capacity for housekeeping, home modifications, transportation, health management, financial services. Those are some of the specific areas that people were unhappy about. And of course, not many people need dental services, but when they need them, they really need them. And I know that's not adequate, and I know housing is inadequate. For dementia capable, I think just continue those efforts to communicate effectively with people with confusion and memory loss. And I don't know if this is something that you ask routinely, but you might include this question: have you noticed a difference in confusion or memory loss over the last 12 months? And that might be a trigger to really engage in those dementia capable services. and look at some of the service gaps and prioritize options counseling with people with with any kind of confusion and memory loss. But overall, I would say keep it up.
Yeah, those were, a lot of them were really good.
So that's it.
Great. And I know that Diana was saying that there are some areas where they had enough data to separate it out for local folks. And do you want to talk a little bit about where they can find that?
You can contact me. I should put that on here, dwhi@pdx.edu. If there were tables prepared, all the ADRC directors should have received those. I think we did 5. And not all of the tables were in there, but most of them that we thought most meaningful. So you can see where you fell on that. And I guess I'll also make the RTZ plug. These came from RTZ data. Yeah, it's dwhi@pdx.edu. And my phone number is 503-725-2725.
Yeah, Jennifer, thank you for letting us know that your ADRC specific data for those 5 areas is actually on the SUA website also, evidently. And so, or at least the data for the overall, it's all on the ADRC website and the State Unit on Aging website. So please share this data and share these reports with your operations councils, your partners. Get discussions going about some of the areas that we made some progress in, and then there's other areas that aren't going as well and maybe need some attention. Like Diana was saying, she gave, the PSU gave recommendations based on overall looking at things. So, you might have those conversations locally with your local folks, with your advisory councils, your governing councils, and most of this information is not only on the SUA website, but it is on the SUA website, Jennifer says. So, any other questions from people? This is great. It's really, you guys are we're doing so much better in some of the areas that were so important over the first couple of years, and even though we're not necessarily meeting some of the really high benchmarks we set for ourselves, we've definitely consistently gotten higher in a lot of the important things.
I think that the one that you never quite reached was that return phone call.
Yeah.
And so this year you did, which was huge. And I think the only other one, some of those benchmarks were pretty high, but you want them to be high. So, so I think you can feel pretty good.
Yeah, I think you guys have done a great job, both INA and I love that the INA time, the response time for more 64 something. A lot of people got a real person, and that the number has come down in terms of people waiting for a call back. So that was really great work, you guys. So overall, it looks really good. Diana's going to hang out for a few minutes if anybody has any other questions. And again, we've been recording this, and as soon as we get it closed captioned, which takes us a few days, we'll get it up on the website by next week. And you can go in and look at all the reports individually or pick the pieces that you want, or the ADRC specific data. So there were some areas, and I'm guessing it was probably at Multnomah County or the metro area.
I think
some of the bigger metro areas probably.
Yeah, I know Metro, I'm pretty sure Cascades, West, Northwest. The other couple I really can't remember.
Yeah, Blaine might be. Yeah, so get on there and look it up, and contact Diana if you have more questions. Yeah, thanks, Deb. She's saying Lane was one of the ones, and Rogue Valley. Okay. Great, good. good.
Would have been my guess, but I didn't want to.
So up and down the valley, it looks like, had the most data. And so that's on there for folks. So if anybody has other questions, we'll kind of hang out for a few minutes. I appreciate Diana's time and being here. And next month we will have a webinar that will be the folks from the SHIBA and the MIPA programs are coming to talk with us about Medicare and how we can help folks get help with Medicare and get prescription help and some other things along those lines. So stay tuned. You'll get your invitation and to register for that, and we'll get this one that Diana just did so you can share it with other folks. And Deb and Jennifer, my teammates, thanks for helping answer some of the questions. Anybody have anything else? Okay, I hope everybody has a great rest of your afternoon and enjoy your summer, and we will talk to you in a month on our next webinar. Thanks, guys.